Let's talk coronavirus. Let's talk about that rule of 6, mass testing and all that with our next guest. She's a director at the NHS Confederation, Dr. Layla McCay. Good morning to you, Layla.
Good morning.
Let's not get into the politics, because that's not where you you get involved in terms of the cabinet. Apparently wanted more than 8 to the most of the cabinet. Matt Hancock, the health secretary, and the prime minister apparently wanted this rule of 6 exempting children from the rule. But let's talk about how much this rule does keep us safe. The argument from the government has been, look, the rules are complicated. People don't know the rules. They think they can meet with 30 people, and they don't realise the 2-household rule. Everyone's confused. People aren't obeying the rules because they don't understand them. You need a rule that everyone can understand. Rule of 6, there you are, done deal. It does include children. In Scotland, it doesn't include children. Under 12s don't count. Do you think that it would make any difference to our safety if children were not included in this list?
It's very hard to know. At the end of the day, the fewer contacts you have with other people, the fewer close contacts you have, particularly the fewer contacts you have in poorly ventilated spaces, then the less chance you have to transmit coronavirus. As to where you draw that line, I mean, that's a decision that needs to be balanced both with the scientific evidence and with political views. So that is, of course, a decision for different governments, and it's not super clear cut where that line ought to be. There's lots of different variables to take into account.
Yeah, I mean, that's the thing. Even in Scotland, this sort of under 12s rule, that doesn't work for me. I've got a 13-year-old, but I suppose it means that, a friend who's got a younger sister or brother could all their family could then, meet up. It just, given that we know, a lot of children, a lot of parents have, family members and neighbours and friends who've got kids at the same school. The kids can sit in a classroom all day together, but they can't come to your home. And a lot of people just think, look, this just doesn't make sense. And if the argument is now that the rules need to be clear and people follow them, surely the key thing is the rules need to make sense. Because, for instance, I don't understand people not wanting to wear masks. I mean, I'd rather not wear a mask. I'd rather there wasn't a coronavirus pandemic. But it seems to me that the evidence has quite clearly changed. We've got more and more evidence now that wearing masks doesn't necessarily protect us, but it does protect others. It brings down the chances of catching the virus or catching a big dose of the virus. Enables more people to feel safe going on the trains or going into supermarkets. Seems to me that is just a no-brainer, and I don't understand why people are making such a fuss about that. But that's because that rule makes sense. But the 6 or 7 or 8 rule, I don't think that does make sense, and that means that's difficult for people to follow.
Well, I suppose there's a couple of things. One is that, as I said, this sort of rule has to be made both with scientific views and with all the other different factors that would make politicians feel it was important to quarantine or to restrict your access to other people. You have to weigh that up against all the various politics of it, in economics, education, etc., and find yourself with a balance. So presumably what is happening here is that the politicians are saying, we really strongly value education and economic recovery, because not only is that good for the country, it's good for people's individual health, it's good for their futures, etc. So I guess that would be one way of weighing up to make those different decisions. But I guess that another way would be analysing the patterns of where people are actually catching coronavirus, and that's really, really important. That's why we have the test and trace program. That's why we have so many people doing all this analysis to understand, wait a minute, there's still transmission, it's going up, where's it actually happening? And in many cases they're finding it's happening in people's homes, because people tend to have quite firm coronavirus distancing and things in the public realm. But when you're in your house, you might tend to forget about that a bit. You might sit a bit closer. You might not have all your windows wide open. Yeah. And all those things would increase the risk as well. So really, it's a matter of balancing the risks and the benefits in these decisions.
Do you think it's still extraordinary how many people are not aware of the scientific and medical evidence of what is and is not safe to do? I'm still stunned by the number of people I see wearing a mask walking down the street. I've seen people in cars on their own wearing a mask. I mean, that just blows my mind. But you're walking down the street. I mean, I'm not talking about someone looking very elderly and just feeling I'm just going to be very careful, but someone walking along the street with a mask on, and I'm going to walk past, and I'm clearly not going to be within their vicinity for more than a nanosecond. And maybe I just look like I'm diseased. I don't know. Maybe it's just me personally. But it's more than a metre apart, and them ducking onto the road to go within, nowhere within 3 metres of me or any other human being. When we know that the evidence is so clear about, having to sit, facing each other within, for 15 minutes, and the risks. The risks are there are risk factors that are really quite clear. And so many people, all these months on, don't seem to be actually aware of what the risk factors are.
Well, I think that how much caution people choose to take is in many ways a personal choice, because people have all sorts of different risk factors that will make that if they were to catch coronavirus, possibly they would be fine, they would have a few symptoms. Other people, possibly because of other factors in their life, other things to do with their health, would actually be incredibly high risk of ending up in intensive care. And those people would be more motivated, of course, to take extra precautions. And I don't think that any of us could blame them for that. Certainly the evidence continues to emerge about how you might or might not catch coronavirus. But taking precautions, such as keeping away from people, even in ventilated spaces, is a reasonable choice to take if that works for you. Wearing masks, of course, as we know, is very much a thing that will protect other people from potential transmission. Protect you a little bit, perhaps, but mostly protect other people.
And that's the key thing, and that's where there is a right for people to say, why aren't you wearing your mask? Let's talk about this possibility of mass testing. There's been quite a lot of concern from the scientific medical community about this sort of moonshot. Someone just say simply, let's just call it what it is, a long shot in terms of mass testing, £100 billion. The government says, actually, no, it's close to 500 million, which is an awful lot less. 100 billion being the best part of, more than 2/3 of the NHS annual budget. But that £100 billion figure is in the documents that have been seen relating to this. There's lots of concern that the diagnostic tests that we have right now are not accurate enough. The idea that we're going to suddenly develop these almost uniquely 100% tests. We're going to have a lot of cases where I think evidence is a fifth of cases that are positive will be missed, but you'll also get up to 2% of false positives, which, when you've got a couple of 100,000 people getting tested, is one thing. If you're going to be testing, say, 10, 20 million people a day, you're looking at hundreds of thousands of people being affected. Is this even viable? Is this something that is actually being looked at as a long-term solution to the problem of coronavirus?
That's what the scientists are asking themselves at the moment. It is in many ways a laudable ambition. It makes sense in the grand scheme of things that this is a possible, at least temporary solution, but it is racked with logistical challenges that make us all wonder whether it is actually achievable, and whether, in fact, it would be more reassuring if we focused on the challenges in the current test and trace system before we started having such vast ambitions that we're not quite clear are achievable. I think that in my mind, there's 3 main challenges. One is that we don't actually have the really rapid saliva tests working and accurate and ready for action that we would need to be able to take this forward. Hopefully those will come, but they are, from everything I've heard, not ready. Then we've got the challenge of the huge logistics that will be required to test such a vast number of people so regularly. Are they all just going to stand in a giant queue coughing all over each other as they wait for the results? We don't know yet. That is a really quite significant infrastructure challenge. And then, as you say, there is this risk that people will be identified as having coronavirus when in fact they don't. That's a risk with every test. We don't know what this new, not yet existing test will be like in terms of finding these false positives. Yeah. But what we do know is that if thousands and thousands of people are being told they have coronavirus and they don't, they're having to isolate, their families are having to isolate, and that's going to have all sorts of knock-on effects. So in theory, this is potentially an interesting idea. In practice, we really need to see more of the detail. Yeah,
exactly. And indeed, I do wonder again if we could focus more on just getting the NHS backlogged up with 2.1 million patients waiting more than 18 weeks for operations, 83,000 waiting more than a year, and 1.2 million waiting just for the diagnostic test in the first place. Dr. Layla McCay, Director at the NHS Confederation. Thank you.